So I've been forgetting things lately and I can't remember where I've placed things. Is this a sign of dementia?
There are several different types of dementia, the most common being Alzheimer's disease. Forgetfulness is the most common complaint and is often reported by family members. People with dementia may have difficulty retaining new information, performing complex tasks, reasoning, spatial orientation, getting lost in familiar places, and difficulty with language.
What causes dementia?
Most dementia is caused by a neurodegenerative disease. This means that over time there's progressive damage of the neurons in the brain, which causes problems with mental functioning. This results from the buildup of abnormal proteins accumulating around the neurons. Some types of dementia, such as vascular dementia, are related to impaired blood flow caused by things such as high blood pressure, diabetes, high cholesterol, smoking, and others.
What kind of tests do I need to determine if I have dementia?
Your doctor may order a CT scan or a brain MRI, as well as doing some lab work to help rule out other conditions that can mimic dementia. Your medication list should also be reviewed as well, as some medications can cause dementia-like symptoms. A large part of diagnosing dementia comes from interviewing the patient and family members. Some screening tools, such as the MMSE, are helpful to determine the severity of your symptoms.
What treatment options are there for dementia, and what follow-up is needed?
Although there are some medications for dementia, the majority of treatment is still symptomatic. This means that the focus of treatment is on decreasing behavioral disturbances. Follow-up testing may include repeated mini mental status examinations to evaluate the level of cognitive decline. Discuss medications with your neurologist to determine the best medications for your loved one.
What precautions do my family and I need to take to ensure that I'm safe?
Patients with dementia will likely need modifications to their living environment and routine to ensure their continued safety. Activities such as driving, cooking, financial capacity, wandering, falls, medications, and living alone should be discussed with your neurologist.
Dementia is characterized by a decline in mental cognition. The most common type is Alzheimer's dementia.
Most dementias are neurodegenerative, meaning the damage to the brain is progressive and worsens over time.
Oftentimes, a diagnosis of dementia comes from interviewing family members, as well as simple screening assessments. CT and MRI imaging may also be useful to look at the brain structure. Remember to keep a copy of any testing done.
For neurodegenerative dementias such as Alzheimer's, there is no cure. Some medications have proven useful to help slow the progression of mental decline. Treatment is often focused on managing symptoms.
Develop a plan with your family and neurologist to keep your loved ones safe. Discuss modifications in routine and living environment, as well as advanced directives.